This isn't even a face scan. This is the cone beam data that was altered to actually see the face. And you can kind of get an idea where the digital wax up is within the smile. And again, she's biting on cotton rolls in a scanner like this, so it's not a truly accurate one. But you can alter that density of the cone beam to get to the soft tissue layer and kind of impose that over your digital wax up. And so this is called a stacked case that I did, where here's the bone reduction guide that got pinned into the bone, and then the surgical guide actually stacks over that. And so you don't have to take your bone reduction guide off. You pin it in, and then you can build this guide over the top and stack it. And then here's adjusting the timing. So remember our implants, we have a hex in there. When you're placing multi-units that are straight, doesn't matter. Timing isn't an issue. But anytime you're placing an angled multi-unit, the timing of your implant is going to have up to a 30-degree swing on the angle of that cylinder that's coming out of that. So if you're planning these angled implants with 17 or 30-degree multi-units, timing is a factor that you can control by a little marking, so that you can have one of the flats. You've heard that term, the flat of the implant. You can have that flat lining up with some sort of marking on your guide, so that when you're final torquing your implant in, you've got your 6 notches on your driver, your 6 dots. You can have that one of those notches stop and line up right on that marking on your drill. What I like to do is just after I print my guide, I just look at the screen and go, okay, it's kind of right up against this guy, and I just take a little Sharpie and I just do a little mark, and it's close enough. So timing is a factor. Does anyone question about that? Like why timing is an issue if you really want to truly digitally plan an angled multi-unit? A little bit. It's a little bit of a complexity to that, but if you were to pre-plan your prosthetic, where you put your implants in and you put your cylinders on and you have your prosthetic with the holes, and you want it to drop over everything, that 30-degree play of that cylinder could make it so it doesn't slide on. If ideally you want everything just to slide on, then yeah, you got to have timing into consideration.
So you just put the flat.
Yes, and what you want is the flat in the I think the simplest way is when you're planning the case. You plan it so that one of the flats is towards the buccal, and then when you're delivering the case and you're finally torquing your implant, put the flat to exactly that position, that flat, and maybe it's just on the buccal every time, just straight buccal, and that's a good way to just be really simple with it. This is a way to digitally plan it and put a mark on it so that that's where I want one of the flats to line up. And that way when you put your multi-unit on, the angle is coming where you want it to be.